record this. Okay. So that's how it came to be. Now remember that there's a ton under the surface that you can't see, feel, know, hear, understand, or that sometimes there's any really good laboratory tests or imaging tests for us to understand why or how it's happening. So if we understand that that's where we're starting from, then there is a need, a significant need for us to look underneath the surface, to look at what's not obvious, to try to dedicate ourselves to more challenging things. Are you only seeing the iceberg, or are you seeing all that stuff on the side of my screen too?
Just the iceberg.
Okay, good. Put the iceberg back in its place. All right. Something that I've learned over these 13 years of doing human healing with regenerative agents is healing has a hierarchy. I had to learn the hard way that using regenerative agents from the top through the structure and neurologic route is a very partial and ultimately pretty short-sighted way of trying to help a human heal. It was 10 years ago that I was doing basic bench research on how to help physiologic opportunities, diet, supplements, minerals, hormones to help people heal. But the emotional and energetic components of healing are the most important. If the mind and heart, the energy and the emotion of the body and mind, heart, and spirit are not involved in the healing process, it will subvert people healing. Admitting a couple more people here, guys. Welcome, everyone. We're in the middle of the pre-Zen. So keep this in mind. If you're not dealing with those deeper 3 layers or the deeper 2 layers, the parts above will not sufficiently heal, or they'll heal for a short period of time, but not remain in a healed state. In other words, it'll deteriorate again. Okay, this is the emotional one. It's the deepest one. It's only been the last 3 years that I've been working on this really significantly. Is that bar getting in the way of everybody's view? All right, that should be good. Is that whole screen visible to everyone? Emotional contribution being that really big, complex onion diagram.
Yes, sir.
All right. We start early and often working on the deep mind, heart, soul healing and the emotional realms. I'm going to tell you point blank, if you come to heal and you're holding a grudge against a physician, you're holding a grudge against an insurance company, you're holding a grudge against the FDA, you're holding a grudge against the pharmaceutical industry, you will not fully heal. We're not saying that these things are good or that they did something right, but if you're still holding a grudge against those individuals, you will not fully heal. That's not an easy pill to swallow, but resentment is basically like drinking poison and hoping the FDA dies or the pharmaceutical industry dies. It'll never work, and getting past that point, or at least addressing that point, is going to be an important piece of healing. I'm saying that point blank because this is what I tell people in the office. These things need to be left behind you. It's in your past. You're dealing with the after effects of a very terrible thing, very challenging thing. Let it be, let the rest of what happened be in the past. Stellate ganglion blocks. I started doing these about 10 years ago. Under ultrasound guidance, the fight or flight nervous system is actually reset using anesthetic and in the last year and a half, oxytocin hormone. Combining that with acupuncture, intuitive healing, psychology, healing touch, and ketamine. These are a very important set of things that we do individually for PTSD and long-term emotional challenge for people. But this is something I wouldn't say I prefer I do. If somebody doesn't want to do this, so much is left on the table that it's hard for me to do the rest of the healing process with somebody. Very least, somebody saying, all right, fine, I will accept that I have to do this, but I'm not all the way there yet. That's fine. Everybody has their own process, but understand this is a big piece of it. Here's one of my biases. The giftedness that each of the individuals have that we're working with, applied through our different skills, is how we do what we do. To just do technical procedures on somebody or acupuncture on somebody or look at some labs and only do that removes the heart and mind from us as practitioners out of the equation. And that's far inferior. That how part is far superior than the what part. In other words, are we meeting you where you need to be met? And if we're not, we need to work a little harder at that. The energetic section, I have Dr. Mark Harris in Bozeman, Montana to thank for tying about 6 different pieces of energetic healing together in my mind: the thoughts, the intentions, the hopes, the beliefs, the prayers. These things matter. They matter through our placebo effect. Over half of your healing has more to do with you and how you feel and think about your condition and what you're going to do with it than it does what we are doing. We're here to be your cheerleaders for your own healing. By the way, the emotional is in this group too, but it is so much the most powerful piece that we pull it out into its own group. So Mark Harris is the only guy in the world that has a PhD in quantum biophysics, and he's the one who helped me put together this concept. I love the fact that I can learn so much from other individuals who have had such rich backgrounds. Onto the physiologic piece. If anybody's not keen with this piece of the equation, you need to be. Diet, supplements, gut, hormones, mitochondria, heavy metals, immune system, chronic infections, toxic medications, other ones besides fluoroquinolones, mold, yeast, energetic medicine technologies, that's PEMF, that's laser, that's infrared. How we physiologically or chemically work with you, extremely important. Again, though, I don't want to be in the top of the iceberg, because if we're doing that, a new top is going to pop up, and I don't want that to happen for you. The more things in your deep physiology that we can understand and address, the better chance you're going to have meaningful healing. Who hates their neurologic system? The buzzing, the burning, the searing, numb, tingle, the pain everywhere.
Yes.
Very, 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 very common problem. Direct axonal damage, I believe also glial cell damage. Glial cells are contributing and modifying cells within the nervous system, peripheral nervous system, that helps those propagate signals. There are 6 levels of your neurologic system that we're looking at: the very superficial, local, compound, local, the nerve roots as they come right out of the spine, the autonomic or fight or flight nervous system, and the central nervous system. And looking at your previous injuries, what you'll hear from people oftentimes is, I was injured here 20 years ago. I took fluoroquinolones and all of a sudden this nerve area is hurting now. Sciatica, previous injuries to even joints where the autonomic nervous system has created some abnormal connections. This is where the rubber hits the road. I think this is an enormous, not just contributor to, but actually modulator or underlying problem within fluoroquinolone toxicity. And it's very complex. It needs to be handled from many different directions at once. And finally, structure. More often than not, I have everybody talk about things like their neck or their Achilles or their knees or their pelvis or their low back. And this is very complicated because not only can it be direct deterioration at the structure, but local adhesions. Like for the Achilles, there's a sheath around the Achilles. And adhesions between the sheath and the Achilles is a contributor, as our constricted nerves, as our abnormal nerves, as our nerve roots. It's not just somebody's Achilles tendon that's abnormal, even though that's one of the black box warnings. But how much you've prepped, and looking at that stack the way that I have them, structural healing can be very easy if you deal with all of the other 4 levels at the same time prior to that point in time. But if you hit your structures before you've dealt with all the other pieces, guess what? It doesn't heal well and it gets really angry. Okay, here's another way of looking at this. I try to bring forward many different ways for people to understand that there's a hierarchy and there's a way of approaching these things in a logical, organized way. And I can't do all of these things, you guys. I used to do parts of all of them, but as they grew and I understood their importance, I realized I had to have other people in my system that were working on each of these pieces because they can do it better than I can. I can only do so much. And I've given up trying to do mitosis of myself because I think the world can only handle one of me. All right. So how do we get symptom and deep healing work at the same time? You go to the roots, go deep, be complete, assume nothing. Listen to the person. I'm going to tell you guys that way back when in 2011, when I was in Colorado, fairly well-known Floxy came to see me. I hope you guys don't mind that I call you Floxies. And I thought everything was her musculoskeletal system, her tendons, her ligaments, her pelvis. And she ended up getting very excited that I said, no, I don't understand all this. What do you know? And she sent me 80 articles, most of them having to do with neurologic abnormalities that happen in fluoroquinolone toxicity. That individual was at the first FAHA meeting. I was very glad to see her there. And the very bottom one, keep your ego in check. You can't listen to a person, to a patient. You can't hear their story. You can't see, you can't understand what's important to them if you think you have all the answers. I'm going to tell you, not surprisingly, hopefully, half of what I do has some form of patient involvement in me having developed it. Either it was at a time when I was asking a question, they were offering something. They had done hundreds of hours of research on the web and found little esoteric tidbits of information. I get almost as much information from patients now as a physician as I do on my own studying. So please, even though you're going to get refused, every once in a while you'll find a physician that really wants to hear. All right, healing is a hierarchy. So far we have selfless, skilled experts and hierarchies of healing that we've talked about. Okay, I'm going to let you guys read those. These are the things that I've learned over time that are important for us to, important enough for me to call these our guiding principles. You can read them far faster than I can read them to you. You're going to hear quite a few of them as we go through this because it's laced into all the ways that I think and all the ways I approach things. All the way from the really simple ones like you can't force healing, all the way up to the number 9, really esoteric. Each gifted healer combines and synergizes via quantum energetics. Those are some slides that I've created for the Regenerative Masters group and the FAHA group that I haven't even shown them yet. I like number 11, and I'm gonna come back to this at different times in the talk. Knowledge is free, everybody. The idea of holding on to knowledge as though it's something that you can own, I think is against everything that we believe as physicians. And that was one of the principles that we helped to put together with the FAHA conferences. We will share freely. Number 1, it's the right thing to do. Number 2, remember when I said that how we do what we do is far more important than what we do? If you have a Lamborghini, but you have no gas for it, how well does that Lamborghini work? The gas in the Lamborghini is how we do what we do. It's the heart and the mind. It's how we engage a person. It's how we work with somebody. And that is going to increase or decrease your own placebo effect, which again is at least 50% of your healing. I don't want credit for your healing. We are here to help your body heal itself. You deserve that credit, not me. Now, I scattered these little bubbles all over the upper and lower parts of the iceberg because think conceptually, we're going to hit this iceberg everywhere we possibly can with our approaches and try to blow the whole thing up. I don't want to just get those symptom ones that are poking out the top. Again, why? Because you'll get new symptoms that'll float out the bottom. All right. Now we've got process, perspective, guiding principles, and selfless experts. When we apply this to fluoroquinolone toxicity, what do we get? A big mess. There's a lot to consider here. This is an abbreviated version. The bigger one was about twice this size, actually. Why does collagen become deteriorated? Why does your neurologic system become affected with fluoroquinolone toxicity? How do the psychiatric and the neurologic overlap each other? How do your physiologic and psychological things overlap each other? How do the adducts on DNA affect its function? Perhaps the deepest form of injury in fluoroquinolone toxicity. If you have a lot of underlying conditions, be they physical, mental, spiritual, emotional, intellectual, body, mind, heart, spirit, how do they contribute and how do they get in the way of your ability to heal? There's one individual here who's with us who will tell you that the overlying effects of mold toxicity are so significantly similar to fluoroquinolone toxicity. If you're not looking for that, then you've missed a very significant opportunity to help somebody else heal. But you got to stop and look for it. All right, that's very busy. There's a much busier version of it. And this is yet another way to let you know why I can't do all of this. All right, here's a big, busy slide. This is again a bit abbreviated, but these are the skill sets of the various providers that are part of Regenerative Masters and FAHA. There are more than this. And yes, I'm biased. I did regenerative injections, really expanded because that's where my brain is. But think about putting all of these things after a significant history and physical examination, figuring out the major pieces for each individual, and then being able to apply these skills and these tools toward healing with the practitioner that's got the right heart, at the right time, in the right amount. This is what I've dedicated my career to. Okay. For those of you who have seen me, you've seen this very, very busy diagram. That was 13 years of experience put into one regenerative method and approach. This has even changed slightly since I put together this slide. This day, I used to do 2 to 7 days before this day. Now I do it 2 weeks to 3 months prior to. We'll get into that in just a little while when I put out kind of a basic diagram of how we approach this as a group. This is a ton of information, an amazing amount of information. And if you just look at what I'm acquiring, blood, bone marrow, bone, adipose, cerebrospinal fluid, vascular aspirate, synovial fluid, some of them multiple times, and injecting them in dozens of locations around the body to give local, regional, or generalized healing. This is a lot to do just from the regenerative standpoint. Okay, Jerzy Trzaskowski. This is his slide. He's been in the floor going along community for a very long period of time, has come up with a lot of thought processes and a lot of individual ways to approach the physiologic and the DNA damage pieces of the equation. So I thank and applaud him for allowing me to use this slide. How do we affect healing even at the level down to the DNA, the mitochondrial DNA and the nuclear DNA? Because look at all those different things that can happen if your DNA remains injured. I'm not saying that this question is entirely answered yet. Do I believe it will be eventually? Yes, I do. What do we want to get done here? We want a personalized, specific, organized, ordered for optimal results approach with appropriate follow-up, meaningful healing, heart-centered science-backed care in 6 to 12 month healing paradigms. Yes, 6 to 12 months. Somebody walking 5 minutes after a treatment or 1 day after a treatment is really nice to see. It gives someone hope. I'm glad that happens. I care about what's happening to people 6 to 12 months after I'm working on them. Why? Because I can tell you which pieces of the healing paradigm are going to give the longest and most optimal results. And they're always going to have significant contributions from your engagement of your own care. We can be cheerleaders, but ultimately you're looking at unraveling the injuries from this set of antibiotics in a 6 to 12 month period of time. By the way, all the other regenerative conditions that I work on, this is when people are getting their most significant outcomes is 6 to 12 months after treatment. Doesn't mean there aren't some upfront and early. And sometimes there are grand slams where somebody's great after 1 to 2 weeks after treatment. I try not to parade those around, and I try not to make those seem like my usual outcomes. One of the, a couple of the other ideas for FAHA and Regenerative Masters is to spread the knowledge, to publish, expand into other sites nationally. If you have an extremely engaged, interested, selfless practitioner that you work with, we want to expand FAHA. Oh, the other goals, we don't like one-man bands and we don't like playing whack-a-mole. I've played whack-a-mole before. I love that game, actually. It's irritating as heck, but I love it.
Long time.
Okay. Which one did you rather listen to? The one on the left is kind of cute and fun to see what he does, but ultimately 100 different people playing their instruments in resonance with one another is going to move your soul. And that is what we are looking to do. Now I'm going to be very, very, very pointed here. I will never have you sign an NDA. I will never put a gag order on you. I will never threaten you with a lawsuit if you go share what I give you. Why? Because I want you to. And the idea of doing this with patients makes me feel like that guy in the right upper corner. It's disgusting. The whack-a-mole approach, honestly, I did this for the first few years. We don't have to do a whack-a-mole approach. There are tools, there are known underlying mechanisms, there are ways to assess, to give us deep root level information. But we don't have to practice way outside of our underlying training. We can complete the labs, the imaging, the concrete evaluations. We can collaborate and synergize together. And yeah, your candidacy is based much more on than what's in your bank account. It's how can we serve you based on what we have to give you, and us being able to live through the gifts and skills that we've been given. All right, now we have the mindset for healing, processes, perspectives, more specific to fluoroquinolone toxicity. We've got guiding principles. What else is there? Okay, there's the big approach. Pretty simple diagram. You call in, one of my staff is going to give you some information. They're going to get you on the phone with me. We're going to discuss what the processes and possibilities are. You're going to be having an initial evaluation, 1 to 3 months of optimizing your emotional and physiological contributing factors. Then, depending on how you're doing, we might end up doing the expanded nerve and structure injections, more IV treatments, more of all of the different 6-sided approaches, or you might push that out even further because you're doing well. With a very careful 6-sided approach over a 3 to 5 day period of time, very pointed for your underlying dysfunctions, it's going to make a difference. And if we let that sink in a little bit physiologically, emotionally, and neurologically, that might be all we need to do. For sure, I believe that's true of the mild cases, perhaps the moderate cases. Severe cases are probably going to need the more expanded approaches, but we have ways of evaluating with that, and we care enough to really make sure that we're following up with you on a regular basis. Eventually, all this information is going to land at the 12-month and 24-month endpoints, at which point in time we will be publishing this information. We want as many providers as possible to understand how to tackle this. Because honestly, everybody, there aren't very many practitioners that are going to want to tackle this in the first place. So we're going to try to get as many of them as we can. This is that challenging for us to take care of this as well as we can. Right, very, very busy slide. This is that first visit. We're here for 3 to 5 days. Let's just say 5 days of treatment. The sympathetic nervous system, and it's an incredibly important modulator of the abnormalities that are happening in for sure, the neurologic system, but also the structural system. And that all loops back into the other 3 layers, the emotional, the energetic, and the physiologic. If we can get your sympathetic nervous system quieted down, we've done some tremendous good. Here we have the stellate ganglion blocks, ketamine, acupuncture, deep emotional healing, induction of the parasympathetic nervous system. Thereafter, I'm actually guiding now injections with PRP into other parts of the neurologic system, the nerve roots, other parts of the sympathetic nervous system, sometimes into the central nervous system via different routes. Using ultrasound and fluoroscopy. There's acupuncture, intuitive healing, naturopathy, functional medicine, specific labs. That's going to be for sure the mediator release test to look at underlying things that your 175 different foods and chemicals that you might be reactive to. Because guess what? If we don't get your immune system happy, it's going to be hard for you to heal. Physical therapy, evaluation, and treatments. That's Shannon Maxner. I mentioned she was on the other slide. MAT, 35 years of being a physical therapist, incredible human being. A couple of different chiropractors, Dennis Wogan, who coined the term floxy neck, and Paul Nash. Dennis has nearly 50 years of experience. Paul Nash, about 35 or 40 years of experience. I call him Dr. Brown, like from Back to the Future. He's got kind of the big fluffy white hair, and he's got like a crazy tool for everything. There'll be some initial IVs, peptides, hyperthermia treatments, ozone, shock, laser, exercise assessments. Ultimately, this 5-day period of time with all of these evaluations, putting you into them 1 of 3 groups going forward, this is about $12,000 to come and do with us. Plus or minus, depending on if there's some extra labs that we need to do. But I'm sorry, I forgot. MRT, some basic labs on just organ function, stool analysis, mitochondrial testing, and hormones at the very least. We're going to screen for at least those things, because that's going to get us most of the problematic physiologic things to work on with most people. Thereafter, we may have some other labs that we're going to do with you. That's a lot to do in 5 days. Been a lot of years now that I've had patients coming from national and international sites to see me. It's 11 years. So bringing people in with adequate information, adequate understanding, and some hope going forward, knowing that there are going to be many possible pathways that we're going to need to take you down, because no one size fits all, everyone. Because at the end of the day, I want to see you. Yes, that was all the way up at the peak. I want to see you up here. I want to see you getting to the top of your proverbial climb. I want to see you engaging and enjoying the things of life, the things in your careers, the things in your families that you want to be able to live and understand. And at the end of the day, I'm going to just tell you, when you're enough through this that you can look back at it and be thankful that it happened in your life. Okay, don't throw things at your screens. I know you're probably not there yet. When you're at that point, that's frankly a beautiful thing to get to experience with another human being, and being a part of that process is the privilege that I get to live every day. And I look at it as nothing less than that.